It's 8:45. Good morning. AM 1430 KRGI, 105.5 FM. A guest today from Central District Health Department, one of the community health nurses, Jodi Garretson's back here to talk about flu vaccines. Welcome back.
Thank you, Brian. Good to be here.
We've been doing this a while.
Yeah, a few years.
So we're sharing photos of kids and grandkids and all that. But that's another story. We're here primarily to talk about flu vaccines. It's hard to believe, but we're getting to that point of the year that we need to talk about this. So let's start to get the word out about flu vaccines and what folks should keep an eye and an ear out for.
Yes, it's getting to be time for this next flu season, the 25-26 flu season. So it's already time. We're starting to give some flu vaccine. So it is recommended, again, for everyone 6 months and older to get a flu vaccine with very rare exceptions. So it's good for children and adults to get that flu vaccine this year.
So as you are hearing the input, to try to determine the vaccines and things like that, are there any other major changes that we're hearing about in regards to a vaccine that you have to say, well, we've seen this strain or this strain, you need to be aware of that?
It's pretty similar to last year. However, they do update it each year to cover like minor changes in the strains. But again, this year's flu vaccine covers 3 strains, 2 influenza A strains and 1 influenza B strain.
Availability look good right now?
Yes, it's looking like it will be very available, and very soon we'll have vaccine for those who don't have insurance. So the inability to pay shouldn't impact anyone.
Based on that availability and based on trying to fit schedules, what are the procedures folks need to know and be prepared for if they're saying, okay, I want to get my flu shot?
Yes. So for us at Central District Health Department, we will be able to take walk-ins anytime Monday through Friday when we're open. Right now, we are currently having walk-ins for those who have insurance, like a private insurance, children with Medicaid, and those who are uninsured. By the end of the week, you should be able to walk into our office and get that. So it's pretty simple. Just come on in. If you have insurance, bring in your insurance card. If no insurance, just let us know that.
But you're saying that children as young as 6 months are able to go ahead and get this, and it's a great way to help prevent flu.
Yes, even as young as 6 months old. So sometimes that can be put into with the vaccine or given with the vaccines that they're getting at 6 months if they're getting it at their doctor's office. But also they can come into our office if they're getting that separately and just want to walk in to us. So yes, it's important for children and adults, and just knowing that influenza may be mild for some people, but it could be harder on other people. So,
if folks have questions, what should they do?
They need to call us at Central District Health Department, 308-385-5175, and we can answer any of your questions.
Flu vaccine season is here, and you can get a head start with Central District Health Department. Jodi Garretson, come back, okay?
All right. Thanks, Brian.
Good morning from AM 1430 KRGI, 105.5 FM.